Assalamualaikum warahmatullahi wabarakatuh. The Honorable of Participant Oral Presentation in Icon said Universitas Nadatul Ulama Surabaya. Let me introduce myself. My name is Resti Utami. I'm from Doctoral Program of Nursing, Faculty of Nursing, Airlangga University, Surabaya, Indonesia. And then I want to present about my research. And the title of my research is Effectiveness of Relevant Intervention with Readiness for Discharge in Transitional Care of Stillbirth with Systematic Review. Transitional care from hospital to home is very important for parents where parents take all responsibility in the activities of caring for their babies. This is a period when things can go wrong if parents don't have the knowledge and skill needed to care for an infant at home. Although discharge education has been provided in many hospitals, there is currently no standard measure used in pediatric transitional care setting, especially in lower weight infants. This condition triggers most parents to show that they are still less prepared to go home. As a result, parents often feel unprepared and lack confidence in adapting to their new role as a primary caregivers in caring for lower weight. Nurses play an important role in facilitating the transition from hospital to home for parents with lower weight. Transitional care is carried out by preparing for the return of parent by nurse starting from the time the baby is cared for in the infant care rooms. Nurses take a very important role in preparing to return to the family, especially mothers, in increasing their confidence in caring for babies at home. Therefore, this study aimed to summarize the evidence identifying the effectiveness of intervention relevant to discharge readiness in improving transitional care. Wait. And then the material and method of this study is the search strategy carried out in the systematically using medical subject heading, namely discharge readiness, readiness for discharge, discharge preparedness, continue of patient care, need to discharge, discharge teaching, and search for article through database such as Google Scholar, EBSCO, Saga, Science Direct, PubMed, ProQuest, Scopus, and Ovid to identify relevant articles. This search is limited to current journal article from 2015 until 2022. The selection of articles in the systematic review referred to the preferred reporting in item for systematic and meta-analysis or PRISMA guideline to gain insight into the effectiveness of intervention relevant to discharge readiness in lower weight transitional care. The eligibility criteria used in the systematic review in the study used the framework. And in the Prisma guideline, we can see in the left side, and then from this PowerPoint, and then the picker framework, which including inclusion criteria and exclusion criteria in the right side of the PowerPoint screen. And then article in a review. The analytical quality of eligible article was assessed independently using the critical appraisal skill programs. Research articles that meet the inclusion criteria are then entered into the bibliography software, Mendeley. Eligibility search articles were then assessed and synthesized. And then the result and this discussion discuss of this study is the studies include in the review use a variety of intervention strategy. This study involved a skill training intervention in 14 studies using technology assist intervention, app based and video in 5 studies. Several studies have taken the form of training intervention in conjunction with counseling or other form of intervention to improve self-management outcomes, such as conducting demonstration of infant care and breastfeeding to increase confidence in caring for infant and encourage family participants in caring. Previous Research found that discharge planning, discharge teaching, and empowerment programs were significant intervention to build readiness to return home. Previous research found that discharge planning, discharge teaching, and empowerment programs were significant intervention to build readiness to return home. Parent empowerment program can increase the interaction between parents and children, which children or infants, which will affect the emotional relationship between them. Educational program intervention were observed to have more positive parenting interaction and provide stronger confidence in their ability to care for infants. The educational material provide focus on providing general information about low birth weight, risk factor for low birth weight and low birth weight care. The results in this review are in line with the research conducted by Pineda. Say parents may not adequately identify risk factors early and change in the development of low birth weight may result in a lack of understanding of low birth weight care needs. Outcomes in the form of transitional care were assessed, consisting of transition to parenthood and transition from hospital to home related to ability to care for low birth weight. The unprepared of parents in the start of patient and family causes a spared psychological pressure for parents and caregivers of children or infants. Feelings of guilt and helplessness can contribute to the health of children during the transition period. The unpreparedness of parents in the discharge of patient and family causes a spared psychological pressure for parents and caregivers of children or infants, feeling a guilt and helplessness. This suggests that such intervention may be beneficial for parental or family self-efficacy. Although the intervention period varied across the study, the key in the table 2, the skills training intervention showed effectiveness in improving many components of self-management, provide training to mother on how to care of low birth weight can be a used and effective method in the process of adding baby weight and can shorten the baby's hospitalization. Limitation of the systematic review of the study is the limitation in the systematic review during the literature identification, analysis to complaint, and summarizes process as a following. The systematic review is empirically limited because it's only identified study in English. The review only performed a narrative analysis. And then the conclusion of this research is the systematic review highlights the effectiveness of research on the use of intervention relevant to discharge readiness for transitional care in the maternal or father population or families who are at high risk of having low birth weight, so that families can carry out transition care at home as indicated by an increase in transitional to parenthood and transitional for home. So hospitalization related to the ability to care for low birth weight. The systematic review emphasized the need for research on this topic, given its relevance for low birth weight or premature family. Okay, thank you for the attention and wassalamualaikum warahmatullahi wabarakatuh.